Hi, I'm Nick from A-dec, and this is a series of short videos to talk to you about some of the benefits of working without a spittoon or cuspidor. When designing your new surgery, if you've made the decision to work without a spittoon, you'll find that lots of new options become available to you. Here, for example, we have an A-dec 500 package presented without a spittoon and with a ceiling light. This gives us a real clean, fresh look to the surgery and allows really good access on both the left and right hand side of the chair, both for patients to enter and exit the chair and for the dentist and assistant to get really close access during treatments. Working without spittoons or cuspidors has been very popular in some markets for a long time. We've seen a huge increase in people choosing to work this way in other markets this year. One of the main reasons is due to improvements it can offer you around hygiene and reducing the risk of cross-infection. When we look at a chair package without a spittoon, you can see how much less there is to clean. Studies have repeatedly shown that the spittoon is the area which presents the greatest risk of cross-infection in the dental surgery. If you imagine removing this element of risk and also reducing the amount of time that your team have to clean down a dental unit between every treatment, you can see some benefits around ergonomics and efficiency, as well as reducing the risk of cross-infection and improving hygiene in your surgery. I'm often asked what alternatives we have for rinsing patients' mouths if we choose to work without a spittoon. And one popular method is to use a 3-in-1 syringe to rinse the patient's mouth and high volume suction to remove any excess liquid. A-dec equipment comes with the option of a 15 ml high volume suction on every package, which helps to increase the airflow within the oral cavity and remove as much water as possible. This will help us to achieve a clean feeling in the patient's mouth without the need to stop and interrupt our treatment by lifting the patient and allowing them to use a spittoon. If you have concerns about the taste and quality of your water, you may wish to consider the A-dec ICX water treatment tablets. These are tasteless and provide a great experience to the patient if we're using the dental water to rinse their mouths. If you choose to work without a spittoon, but still want to offer your patients an opportunity to spit maybe at the end of a treatment, there are still options open to you. You could, for example, have a separate hygiene room outside of the surgery, which is a place where patients can brush their teeth and rinse before and after a treatment. If you don't have this space available, or you prefer to offer patients the opportunity to rinse immediately after the treatment within your practice, a really popular option is to use a funnel attached to an additional high volume suction. This can be placed next to the patient, and the patient can hold this themselves close to their chin, rinse and spit. This reduces the risk of patients missing and spitting on the chair, the floor and the assistant, and eliminates the cleaning required when using a dental spittoon, but still gives patients the opportunity to rinse and spit at the end of the treatment. When you first start working without a spittoon, you'll probably notice some efficiency gains straight away. Did you know it takes around 90 seconds for a patient to rinse? By the time you stop your treatment, raise the chair, allow them to swill and rinse a couple of times, reposition themselves, and then bring the chair back down to a treat position and starting again. If, for example, you saw 15 patients a day and they rinsed on average 3 times per treatment, you'll be spending over an hour a day with your patients using that spittoon. So by eliminating the spittoon and using either a 3-in-1 and high suction rinse from the treatment position or a spit funnel, simply at the end of the treatment, we can eliminate all of that wasted time and make you much more efficient. Working without a spittoon can offer some significant cost savings, both upfront and in the long term. The initial upfront cost of a spittoon could be as much as 15% of the package cost. Imagine being able to use these funds to invest perhaps in electric micromotors, intraoral cameras, or a higher specification dental chair. We should also consider the reduction in cost for consumables by eliminating the spittoon. If we no longer have to buy plastic cups, mouthwash tablets, and spittoon filters, we reduce those ongoing costs for the lifetime of the dental unit, as well as reducing the amount of waste that we're putting into the environment. Spittoons in themselves a much more complicated piece of equipment than lots of people realise. A typical spittoon will include circuit boards, solenoids, spittoon valves, and lots of tubing. A-dec equipment is renowned for being reliable, but over the lifetime of a chair, around 20 years, you should expect some maintenance costs relating to spittoons. Choosing to work without a spittoon will eliminate these costs and the risk of any breakdown related to a dental spittoon. Combine this with the savings on consumables, upfront cost, and efficiency gains within the surgery, working without a spittoon makes economic sense.